Assalamualaikum and hello everyone. We are from Group 5. We'll present on case study 1 which is about HIV.
Question number 1. What is PJP? So PJP, which is Pneumocystis jirovecii pneumonia, is actually a fungal infection of the lung. It is a type of pneumonia that is caused by the yeast-like fungus Pneumocystis jirovecii. Previously, it is known as Pneumocystis carinii or PCP pneumonia. This fungus is actually very common in the environment, and usually they rarely cause illnesses in healthy people. However, in immune-compromised people, it can cause lung infection. As you can see in the picture above, that is Pneumocystis jirovecii in its cyst form under Giemsa stain. Actually, PJP is the most common opportunistic infection in HIV-infected people, such as KD. Symptoms of PJP include fever, non-productive cough, dyspnea, night sweat, and others.
The significance of purplish spot over his neck and arms might be Kaposi sarcoma. This is because HIV patients tend to develop skin cancer as they have immune system problems that are unable to protect themselves. However, this happens at later stage of HIV. Next, herpes that caused by herpes simplex virus HSV also can affect the HIV patient. It can cause red blister on mucosal lining and it was same virus as chickenpox. Lastly, tuberculosis can be possible disease where patients with tuberculosis tend to have unprotected cough and having a fatigue.
The third question is to differentiate between HIV positive status and AIDS. So, HIV positive status means that an individual is infected with human immunodeficiency virus, HIV, which is causing the number of CD4 T lymphocytes to be reduced and leading to high risk towards compromised infection. Meanwhile, AIDS, which stands for Acquired Immunodeficiency Syndrome, is a collection of symptoms and signs that develop in an individual with untreated HIV infection that had been progressed into the last stage, which is stage 3. Diagnosis of AIDS is confirmed by low CD4 T lymphocyte counts or development of opportunistic infection.
Question 4. Why is early development of KS and PJP of particular importance in light of his HIV status? HIV patients with weakened immune system, which when CD4 cell count is less than 200, are likely to develop KS and PJP disease. In normal immunocompetent, KS disease that usually occur due to sexual activity are unlikely to develop. Thus, HIV treatment that is ART are needed as it can raise up CD4 cell count and protects against KS and PJP disease.
What factors might have influenced KD's development of pneumocystis pneumonia and Kaposi sarcoma? First, KD has stopped taking his antiretroviral therapy, allowing increase of HIV load in the body. High HIV load in the body can cause low concentration of CD4 in range below 200 and below 100 cells per millimeter per cubic, which can cause weakened immune system in KD. Immune system damaged by HIV allows invasion and proliferation of fungus Pneumocystis jirovecii, which cause pneumocystis pneumonia, and also allows cells harboring human herpes virus 8 to multiply, which can develop Kaposi sarcoma. Other factor is men have higher risk to develop Kaposi sarcoma than women because of high level testosterone, which promote the HHV infection. Last, skip meals and stress can increase the susceptibility to get infected with both infections.
Question 6. Identify 4 problems you must manage regarding KD. So the first thing that I need to manage is his PJP disease because this disease commonly can cause death in patients with AIDS. We can treat this disease using antibiotic or prophylactic agent. Second, managing his stress and make sure he continues taking his drug therapy because stress can suppress the immune system. He should regularly get the advice from psychology on how to manage his stress. Third, managing his nutritional uptake. Poor nutrition is one of the major complications of HIV that can lead to AIDS, while healthy diet can help strengthen immune system. The last one is treating the Kaposi sarcoma. For someone with AIDS, the most important part of KS treatment is treating the HIV infection with anti-AIDS drug combinations.
Question number 7. What precaution will you need to use when caring for KD? Since KD is an HIV positive patient, so extra precautions should be taken and implemented. These include prioritizing hand hygiene before and after interaction with patients, and after any contact with contaminated item. This is also applied even if we already wear gloves. Hand washing is still compulsory. The next precaution is to always wear appropriate PPEs when caring for patients. We should always wear gloves, protective eyewear, masks, or face shield with safety glasses or goggles during procedures that is likely to generate droplet of blood or body fluids from patient. However, in general, protective eyewear, masks, and clothing are actually not needed for routine care of HIV-infected person. Other than that, we also need to ensure appropriate handling of patient care equipment and soiled linen by following the correct procedures. We also should try our best to prevent any needle stick or sharp injuries.
Focus ongoing of the assessment in this case study are to confirm the pneumocystic gyrivacil pneumonia (PJP). Patient will undergo the lung tissue biopsy to use for polymerase chain reaction (PCR) to detect pneumocystic DNA to confirm the patient has pneumocystic gyrivacil pneumonia (PJP). Sputum also will be taken to diagnose PJP under microscope. Another test is blood test to compare the pattern immunodeficiency and to detect beta-D-glucan. Detection of beta-D-glucan because it is part of cell wall of many different types of fungi which also help to diagnose PJP. Severity PJP also can be detected through CT scan and chest X-ray to know how far the PJP is spreading in lung tissue. Lastly, the patient will prescribe with medicine to control PJP as it can cause death if not treated. For example, patient will be prescribed with trimethoprim or sulfametazole through orally or vein to treat the infection from become more severe.
The next question is about major side effects of the antibiotic used to treat KD, which is Bactrim. So, the most common side effects that develop due to allergic reactions to the drug include rash and fever. The second one is sore throat, which is a symptom of oral thrush that develop as superinfection. The next one is unexplained bleeding or bruising that is caused by thrombocytopenia, where there is a decreased number of platelets in the blood circulation. The last one is cough, shortness of breath, or also known as dyspnea, and pulmonary infiltrates, which are early signs of respiratory tract hypersensitivity reactions.
Question 10. What aspect of clinical can you delegate to the LPN? The answer are B, C, D, E, and F. For B, LPN practice management of implant gas etching. If the values are under 95%, it increases the pneumonia diagnosis, otherwise it is healthy. For C, LPN practice management of hospital infection control. For D, LPN practice management of nutritional or fluid deficit in treating malnutrition and a weight loss consequence of HIV patient. For E, LPN also practices in educating the patient and family regarding hand washing to control the infection. For F, if HIV patients are sedated due to intoxication and treatment of withdrawal of drug, LPN will have the patient to turn cup and deep breathe every 2 hours and repositioning him to maintain expiration precautions.
Number 11. KD is kept on taking Bactrim 2 tablets once daily. He asks why he has to keep taking the drug since the pneumonia is gone. How would you respond? KD's body immunity is still weak because of antiretroviral therapy cessation in 6 months ago, so he has low volume of CD4, which in range below 100 cells millimeter per cubic. Restarted of antiretroviral therapy towards KD, which is in low volume of CD4, is recommended to consume Bactrim for at least 3 months until the number of CD4 improves and stays above 200 cells millimeter per cubic. As a result, Bactrim is still needed to prevent reinfection of pneumocystis pneumonia towards KD.
12. Give at least 4 additional topics that should be discussed with KD before he goes home. So the first thing is side effects of his medications. He should be aware about the mild and serious side effect of antiretroviral therapy. Other than that, it's about consequence of stopping antiretroviral again. This drug must be taken at the right time and the right way for them to work properly. If he skips doses of this drug, the virus could become resistant to the drug and he will be left with fewer options to treat his HIV. Third, is about the risk of opportunistic infection that he can develop and the way to protect himself from those infections. And the last one is about the importance of him to regularly see his healthcare provider and never skip medical appointment that had been set.
Question number 13. What laboratory data will most likely be monitored in KD in the future? In the case study, KD has developed AIDS-related Kaposi sarcoma. So some of the laboratory data that is important for the follow-up of his condition include HIV-related lab exams, TCD4 cell counts. Usually, patient with Kaposi sarcoma has the count of which is lower than 200 cells per mm3. The next one would be HIV viral load count, which is normally will be lower than 100,000 copies per ml for patient with Kaposi sarcoma. And the last one is fecal occult blood test. Fecal occult blood test function by detecting hidden blood in stool, which can be a sign of Kaposi sarcoma in the digestive tract. Positive fecal occult blood test would mean that the Kaposi sarcoma has developed in the digestive tract.
5 opportunistic infections that HIV patient is at risk for developing are tuberculosis, candidiasis, pneumonia, hepatitis B and C, and toxoplasmosis. Since HIV patient is immune deficiency, opportunistic infections are more severe in people with HIV. This is because they have a damaged immune system and have many disease or infection can affect them as immune system that are unable to protect themselves. So, people with immunodeficiency had to have a proper protection, especially practice a good hygiene, food intake, practice a good lifestyle, and always take medicine where it can help to strengthen immune system in HIV patient.
So, that's all from us. Thank you.